The opioid crisis is one of the important issues facing America today.
There is not a state or a region of the country that's not been devastated by this crisis at this point.
And while we've been completely distracted in 2020 with the global COVID pandemic, the opioid epidemic has actually gotten worse.
HCA Healthcare is the largest provider of healthcare services across the country. So if we can, as an organization, approach this problem comprehensively, we can make a huge impact.
Opioid addiction really has impacted kind of every walk of life in the United States.
There are teenagers that are affected by it. There's elderly patients that are affected by it. It will cut across every race, age, religion, ethnicity, and unfortunately affects everybody fairly equally in that regard.
Year after year, due to the opioid crisis, the number of babies who are born that are withdrawing from opioids is also increasing.
I've watched it just destroy good people. What I've seen waking these patients up with Narcan is how brutally honest they are with us. I know they want to get better. You know, they're wanting help, but it has so much control over them that they can't overpower the addiction of it.
What happens is they get prescription opioids from their physician or their provider through a completely legitimate, legal way and for a legitimate cause. And unfortunately, for a certain percentage of people, that will start the path to addiction.
Obviously, as a healthcare provider, we have an important role to play in working with our providers, our caregivers, to make sure we're using opioids in the safest way we can to treat patients' pain.
At HCA Healthcare, our mission is above all else, we are committed to the care and improvement of human life. And I've often talked about the way that extends beyond our hospital walls into our communities. Crush the Crisis gives an opportunity to work in an area where we have incredible expertise and really deploy that expertise to meet the community need.
The genesis of Crush the Crisis grew out of a group that we put together, Sarah Stedman and myself, following a Health Trust seminar on pain management. As an orthopedic surgeon, we're the #3 prescriber of opioid medicines. So I feel a responsibility to be an advocate, an educator around the use of opioids. What we know is if you have them in your home, they can be potentially dangerous. If you have a prescription pain medicine that you got from the dentist 5 years ago, if you keep it in your cabinet, that can fall into your son or daughter or grandson or granddaughter's hands, which can be potentially fatal. We decided kind of a simple idea. Okay, let's try to take some of the prescription medicines back.
And so it's called Opioid Take Back Day because we're taking back the opioids and also the other unused drugs and getting them safely disposed of.
The take back is anonymous. There's law enforcement there. They are taking the medicine, and there's a secure receptacle that's there. So it's as easy as coming and dropping it off and driving off. All of those medicines are then weighed at the completion of the take back event, and they've been able to put that into poundage. Starting with our first event here at just one location, that was approximately 21 pounds, and then really has grown exponentially to 2018, where they collected over 220 pounds. Finally, last year, nearly 6,000 pounds of unused prescription medicine and opioids.
This year, HCA Healthcare's partnership for Crush the Crisis is even more special because we are aligning with the DEA's National Prescription Drug Take Back Day. And so our efforts will only amplify the efforts of the DEA. And our partnership with local law enforcement will also help to support those efforts.
Crush the Crisis has been just a tremendous success for our communities. It's been really a team effort all along, and that's one of the great things about HCA Healthcare is rarely do the best ideas come from people sitting in conference rooms in a corporate office. It's those frontline caregivers and physicians who really come up with the innovations, and our job is to figure out how do we support it, how do we scale it, how do we increase the impact that one doctor can have.
I think it's amazing how one small idea can make such a big impact. Crush the Crisis started at my hospital at TriStar Centennial, and it's just such an honor to get to work here and be on this team. And I'm hopeful for the future, and I think HCA Healthcare is being innovative and creative and compassionate and leading the way.